Welcome to the second part of this Cultural Competence Training program. My name is Carolina Baez. If you haven't checked part 2, please go and check it now. Instructional objectives. At the end of this part of the training program, the learners will understand how the environment affects the quality of healthcare by defining environment and healthcare, and environment and cultural competence. Give examples of best practices. I wanted to start by defining what is environment. Environment can be defined as the totality of circumstances surrounding an organism or group of organisms, especially the combination of external physical conditions that affects and influence the growth, development, and survival of organisms. We can also say that organisms respond to changes in their environment by evolutionary adaptations in form and behavior. How does the environment affect the patient? Environment and healthcare. When we talk about the issue of patient satisfaction, improvement in hospital environment may also have a great impact on the patient experience and compliance with the treatment. Once patients and caregivers feel comfortable in their rooms, their satisfaction is likely to increase. Research on how the physical environment affects healthcare outcomes began in the 1980s. More than 600 studies have linked the hospital-built environment to factors such as patient satisfaction, stress, health outcomes, and overall healthcare quality. The American Hospital Association explained in their publication Improving the Patient Experience Through the Healthcare Physical Environment that hospital and healthcare systems can take a more holistic approach to improve the patient experience by presenting their theory, people, process, and place. The people, process, and place theory consists of, first, establishing a culture of caring, second, implementing process improvement, and third, making improvement to the place of care, including the hospital, physical environment, technology, and even furniture. But why it is important to be aware of the environment when treating patients from other cultures? Environment and culture. Generally, the physical environment forms part of our first impressions. What is displayed in this environment can shape our opinion about the organizational culture. For instance, if we walk in any organization and see a wall full of pictures of male presidents, we're gonna think that the organizational culture is highly masculine and paternalistic. In the case of healthcare, we're not gonna walk in and find a wall full of male presidents, but we're gonna walk in and we're gonna find health promotion, brochures, magazines, and video. So, why it is important to be aware of this? Public health campaigns can increase awareness of health issues, but they might also contribute to build stereotypes. For instance, weight loss campaigns and caregivers attributing all their health problems of their patients to their weight. Memory loss campaigns targeted to older adults. Safe sex campaigns that address issues in the LGBT community. According to the study, Healthcare stereotype treat people who worry that their healthcare providers will stereotype or judge them are at higher risk of health issues. 17% of the respondents of this study said that they felt vulnerable to prejudice with regard of racial and ethnicity, gender, socioeconomic status, weight, or age in their healthcare setting. Health promotion communication interventions could have an effect on cultural aspects of society. Example, by idealizing a particular lifestyle. Interventions can have repercussions in multicultural settings, since members of diverse populations may hold belief or engage in practices considered by health promoters as unhealthy, but which have important cultural significance. In this cultural competence training program, we have learned a lot, but the main objective of this program is to recall old concepts and learn new ones. We have learned concepts like what is cultural competence and why is winning importance today. We have learned about health disparities and how they are related to cultural competence. We have understood how the environment affects the quality of healthcare. But now, I wanted to show you some best practice examples. What should we do? Things you should do to promote cultural competence. Make a commitment to expand knowledge about culture, cultural competence, and the various dimensions of culture in your organization. Make a commitment to develop an understanding of the various cultural groups within communities served by your organization. Include culture and cultural competence principles in the strategic planning, policy development, program design, and service delivery process. Increase the organizational and individual understanding of how the various dimensions of culture impacts the patient that your organization serves and the staff that work with them. Be committed to promote cultural competence. We can develop this commitment through staff development and training, hiring, retention, career advancement, performance evaluations, and employee policies that support cultural competence and linguistically appropriate practice. Create a safe, secure, and supportive environment where staff can explore and develop an understanding of all cultures. Thank you for participating in this cultural competence training program. If you would like more information, please visit our reference page